As director responsible for the services in Nottinghamshire, my biggest concern is how do we ensure that staff can provide safe services for patients and do that day in, day out without feeling pressured or overstressed about there's too much work and demand for them to deal with. And at the same time, we also have to try and find savings as required by the national policies for trying to save money. Meridian, who are a private sector company, approached us with an offer to do a study in the physical healthcare services in Bassetlaw. And once I'd seen it work, I knew that I wanted to apply it across all the other services that I'm responsible for. But equally, I didn't want to rely on Meridian all the time. So what we did as part of the programme was that we brought in people on secondment from clinical services so that clinicians could go and do this work, see how it operated, and crucially, we'd then have the knowledge back in the organisation and we'd never have to use the private sector again.
It's absolutely about services and about our resources. So we've got lots of resources. It's a huge organisation, lots of resources, but we haven't got a picture of where those resources are. Some teams, when you look at it as a whole picture, some teams are really, really overworked and some maybe had the capacity to support others. We'd got no overall picture of that until Meridian came in. We were then able, with the tools that they gave us, to use, we were then able to see it as a whole. It was very transparent. So we could see the service as a whole. So we could see where the resource was, who needed it, who didn't. We could also see at an individual staff member level who was overloaded and who maybe had capacity as well, so that we could make it a fair day's work, which is what they talk about, is a fair day's work for everybody.
So we got time to spend face-to-face time with clinicians, and I think that really helped because we could reassure them and talk them through it, because they immediately think it's job losses. That's their first, thought straight away. So we could reassure them that that wasn't the case, that we just wanted to ensure that the capacity that they had within their service was being placed in the right place for the demand.
I really embraced it as a team leader. It gave me and enabled me to use the tools effectively to manage my team, to know how people were working. Once we'd got the tools in place, we were able to look at the times attributed to each activity and therefore give the staff member the right amount of patience for that day.
Meridian came in and we started talking about the red screen process and looking at introducing something to help us manage some of those barriers to discharge. What we had was lots of different things informally that we were doing, different systems that we were using to try and manage the patients to make sure that they're able to go home when they're ready to go home. But actually what this tool did was it kind of brought it all together for us. So we had one predefined way of this is how we're gonna try and manage it. So actually what it did was it improved its consistency, it improved our communication across the team because we were all talking about the same things every day. So everybody knew what was happening. It felt like extra work at the start, but the benefits at the end were actually that it was saving us time, improving our consistency and ultimately helping the patients in terms of that things were happening quicker for them.
Don't be frightened of it, go with it, give it a chance, see what it can do, work with it. Yes, it will involve some extra work and we're upfront, and Meridian were upfront with that at the beginning, that especially for the team leaders, there will be some extra work involved.
Fundamentally, the outcomes for all of this is improvement in patient care. They are not about losing jobs, then that's got to be positive for everybody.
Going forward, given the financial pressures in the service and the rising demand, in order for us to stay safe and sustainable and to stop people burning out, we are going to have to change what we do. And I think for me, my biggest thing is understanding about how we have further conversations with staff about what is it that we can help you change and help you feel comfortable about changing with it. Because for me, ultimately, it is about providing the best patient care that we can.